where did this jump in pay actually come from? So looking at some of the numbers, there was a jump in pay from about anywhere from around $3,000 to about $4,000 on average per weekly pay for travel nurses over the last couple of years. That was majority due to the widespread infection that was going on, going back to the demand for nurses. But where did this money actually come from? It obviously didn't come from thin air. So what was driving the demand and the increase in travel nursing pay? The main reason we saw a big jump in travel nursing pay was that these hospitals actually received federal funding. They received federal funding, they received PPP loans, and they also received state funding. So during the last couple of years, there was something called the Allocation of Provider Relief Fund, which provided about $178 billion for healthcare providers, such as hospitals. Rural places also got a nice cut of that. Just hospitals in general and practitioners, medical facilities got this giant boost in funding, basically. So about $178 billion was allocated for this allocation of provider relief fund. So I was actually looking at the whole pie. The whole pie was $178 billion. And I kind of looked at what pieces were funding what. So roughly saying out of that $178 billion fund, about $127 billion of that was actually given towards most hospitals. If you wanted to see the actual breakdown of these numbers, like how much was given to rural hospitals, how much was given to, let's just say, high infection hospitals, that's all in our show notes on couplenurses.com, so check that out. I'm not going to numbers here, but about $127 billion was given, for the most part, to the hospitals across the United States. And there are about 6,000 major hospitals in the U.S. So if you break that up evenly, that $127 billion, that gives you about $20.7 million of extra funding per major hospital. And of course, your bigger hospitals received more of that funding. So obviously this $127 billion was not given evenly. Bigger hospitals got more, major healthcare facilities got more of that, but roughly there was $127 billion more money to play around and throw around in. So of course, hospitals having more money, they don't have to worry about, you could say, margins as much because they're getting these millions from the federal government. So they were able to spend it on travel nurses. We also seen a big opportunity in opening new units. A few of the hospitals that we've traveled to, they ended up opening new units. So they didn't just spend this money on nurses, they spent it basically on the whole system itself. It helped out physicians, it helped out certain units. So they were able to use this money whichever way they saw fit. So like I said, of course, hospitals took advantage of this, paid nurses more temporarily, but they also ended up spending some of that money to long-term projects such as new units and things like that, maybe updating their ERs, updating their ICUs, their equipment. So that money was definitely not put to waste. But I'll be honest with you guys, some of that money was also taken as a profit for the hospital. Another, you could say, financial incentive that these hospitals receive from the federal government is PPP loans. So normally when you think of a loan, you think of something that you're borrowing now, and then you're eventually going to have to pay back. But with these PPP loans, it was funding for small businesses, big businesses, any kind of really business was able to apply for it with certain qualifications, right? Hospitals did also qualify for that. So with that being said, about $68 billion was given to hospitals in the first round of the funding. The second round, hospitals got another $29 billion with those PPP loans. So about a little bit over $90 billion on top of the $127 billion was given to these hospitals. And it's a loan, doesn't have to be paid back. So same idea, hospitals used it as a way to build more units, build more infrastructure, renew their equipment, pay travel nurses more. They were thinking long-term and short-term, because think about it, this money isn't going to be available ever again. So it was their one chance in documenting or providing whatever they had to provide for the government to get this money, because in essence, this was kind of like a grant, a free money initiative for these hospitals. So why not take it? The third way these hospitals got extra funding is through state funding. So on top of the federal grants they've got, on top of the PPP loans, they also got a drastic jump in state funding, and states were able to change up the budget to give more money to certain hospitals. For example, I'm from Illinois. I looked up some of the data in Illinois, and on top of the hundreds of billions of dollars that was given to these hospitals, another $250 million was given to hospitals just in Illinois alone. And that being said, there was definitely a lot of money per state to be used on nurses and just bettering healthcare facilities. They got a lot of money over this last couple of years. So they definitely had bigger pockets. More money was able to be thrown around. So that's why you had this drastic jump in not only travel nursing pay, but any kind of traveling healthcare provider. Their income skyrocketed. Some states, some facilities, they travel nursing weekly pay jumped by about 90%. So it almost doubled in certain areas, which is wild to see.